Hi, hello everyone, and welcome to the launch webinar for the Nourishing Policy Index. My name is Dr. Kate Allen. I'm the Science and Policy Advisor at the World Cancer Research Fund International. The aim of this Nourishing Policy Index is to give a kind of helicopter overview of the current state of play of nutrition policy across Europe. And it's part of our WCRF international contribution to the EU-funded Co-Create project. As you may know, WCRF International focuses on cancer prevention and survival through diet, weight, and physical activity. So we know from our own work and also that of others that overweight and obesity is very strongly linked with many different kinds of cancer. And of course, it's linked to other NCDs as well. And this strong cancer link is the reason that 3 of our 10 WCRF cancer prevention recommendations are one way or another focused around weight. In the UK today, we know that 1 in 2 people at some point during their lifetime will develop cancer. And these rates are largely being driven by escalating rates of overweight and obesity. And of course, this isn't just a problem in the UK, but in Europe as well, and indeed much of the world. And in fact, a recent report from the World Obesity Federation predicts that by 2035, 51% of the global population will be living with overweight and obesity. And this is not something that just affects adults, but also increasingly children as well. And we know that overweight and obesity in childhood tends to track into adulthood. So if nothing's done to reverse these trends, then overweight and obesity is due to overtake smoking as the #1 risk factor for cancer. But it doesn't have to be that way. It isn't inevitable that that happens. We actually know quite a lot. We have a pretty good idea of what's effective from a policy perspective in how to create enabling environments, healthy environments that will help to bring down those rates of overweight and obesity and start to reverse that tide and bring those rates down. But despite the fact that we have this knowledge, generally speaking, the trend is still upwards. So that makes it really important to look at what countries are doing in nutrition policy. So where they're doing well, just as importantly, where they're not doing very well, where there might be gaps, where there are opportunities, where there's sort of potential for collaboration, where countries can learn from each other, and where improvements can be made. And all of this is captured within the Nourishing Policy Index. Briefly, a couple of housekeeping points. The webinar today is being recorded, so anyone who's not able to see it will be able to catch up with it. And tomorrow we have a companion webinar on physical activity policy and the moving index. So still time to sign up for that if you're interested. After the speakers are presented today, there'll be a Q&A session, and you'll be able to post your questions online using the box on the screen during the webinar. So please do send us your comments, your questions, your reflections. We really do want to help you and get your feedback. So without any further ado, I'm pleased to hand over now to Professor Knut Inge Klepp. Knut Inge will say a bit more about the Co-Create project and also chair the webinar. He is the principal investigator of the Co-Create project and the executive director of the Norwegian Institute for Public Health. And the Policy Index is a collaborative project between WCRF International and the NIPH. So thank you very much for your attention, and I'm pleased now to hand over to Knut Inge. Thank you.
Thank you very much, Kate, and welcome everyone to this webinar. This is a really exciting event for us at Co-Create to finally have this launch of the Nourishing Index. If I can have the next slide, please. So while there are many research projects that focus on assessing individual behaviors and also weight status of children and adolescents, there are fewer projects that focus on policies that shape the environments that are so important in determining these behaviors and also the weight status of populations. And these policies are to a large extent the responsibility of both central and local governments. So the main objective of the Co-Create project has been and how policy can support healthy eating and physical activity lifestyle that can contribute to reduce adolescents' obesity rates. And for that reason, within Co-Create, the ambition has been to investigate how and what policies are in place and how these policies interact and form a kind of a system. We also have focused on how adolescents themselves perceive and understand such a system and what policies they would like to see put in place. And finally, we also are very interested in investigating how such efforts can contribute to reducing inequality in related to both obesity and health in adolescents. So in order to do this, we have developed methodology for monitoring and benchmarking relevant policies. And we have also developed methodology for collaborating with adolescents across Europe and in developing novel policy options based on what we call a system mapping approach. But in this webinar then, we will be presenting tools developed to monitor and benchmark policies. And this is a very novel area, and there are no gold standards for benchmarking policy for nutrition and healthy eating. Therefore, the goal has really been to develop valid, reliable, and easily accessible and applicable methodology for monitoring and benchmarking policies. And by creating an index of the status of nutrition policies within a country, we can hold the decision makers accountable. We can study how the policy index might change over time. And eventually, we think we can also apply these tools and methodology to evaluate the impact of policy change and how it might affect groups of different socioeconomic backgrounds. So that is the overall Co-Create project, and we are very happy then to be able to launch these policy index today. And this webinar, if you go to the next, here we will now have a thorough presentation of the Nourishing Policy Index by Dr. Joanna Vlad. We will also have comments from WHO Regional Office of Europe by Kremlin Vikramasinghe, and we will also be joined by Mariam Heinen later on. And we will have a view from Italy by Dr. Laura Rossi, and we will also have one other Co-Create youth representative, Susanna Bersinska, provide a commentary to us and how this index can be used as an advocacy tool. And then there will be plenty of time for questions and discussions that I'm very much looking forward to. But first now, I'd like to give the word to Joanna Vlad, who is a Senior Policy Research Manager at the World Cancer Research Fund International, and she will then present the main findings of the Nourishing Policy Index. So welcome to you, Joanna.
Thank you, Knut Inge, and hello, everyone. So I will walk you through the main findings of the policy index and brief, which presents an overview of nutrition policy status in 30 European countries. Next slide, please. So I'll start with a reiteration of the main problem, which also sits at the core of the Co-Create project, which is that childhood and adolescent obesity across Europe is an important problem, and as well, its impact over the life course is an important consideration. We know that government action is key with regards to childhood and adolescent obesity, but is insufficient. The Nourishing Policy Index was developed to look at the interaction of nutrition policies taken by national governments and to provide an at-a-glance assessment of the status of nutrition policy by assessing policy design of currently implemented policy against aspirational policy attribute, which we will explain shortly. It is a tool for policy advocacy, in particular for civil society, including youth groups, in line with the focus of the Co-Create project, to help them advocate for better policy design. It is also a tool for monitoring and accountability of policy actions taken by national governments to be used by actors such as researchers or policymakers. Next slide, please. The index is part of a set of tools that can be used independently or together to monitor, benchmark, and compare national government nutrition policy actions. So I will briefly walk you through the process of producing the Nourishing Policy Index, which is quite long and includes, first, identifying key recommended policies through the Nourishing Policy Framework. Next, please. Which brings together a set of policy actions that are recommended to national governments and that national governments should take, and that together make up a comprehensive approach to nutrition policy for prevention of obesity related NCDs. As a second step, next, we searched and identified policy actions currently implemented by 30 European countries, the results of which are available in our Nourishing database. Tomorrow you'll learn more about its sibling, the Moving database, housed on the same platform. To produce these results, we carried out an in-depth search for national level policies supported or endorsed by national governments relevant for reducing obesity and diet-related NCDs by promoting healthy diets, and related to one of the policy areas of the Nourishing Framework. These policy actions, once sourced, were verified by in-country experts, and these were civil servants or researchers at public bodies in the respective countries. Third, once policies are collected, they are analyzed with regards to their policy design by applying our Nourishing benchmarking tool. The benchmarking tool provides a value on the strength of policy design based on applying standards or benchmarks made up of aspirational attributes. That means we don't look at comparing countries with what a model country does, but we assess policy design based on standards that are based on an extensive review of current evidence as well as expert consultation. And you can consult these aspirational standards in full by visiting our website. And we also have published a paper on the development of these benchmarking tools, which I will link to later. Fourth, and next, please. Policies across all 10 policy areas of Nourishing in each country were assessed, the results of which were made available in 30 country snapshots which we produced and we are launching today. They present an in-depth look at the quality of policy design in each country. And finally, next, we compare countries in our policy index and an associated policy brief for each policy area of the Nourishing framework. So to recap, we have set, next slide, please. We have a set of policy tools that were developed to monitor and assess national government policies, therefore to hold national governments accountable for diet and nutrition policies for NCD prevention. These tools are self-standing, but they can feed into one another to produce the Nourishing Policy Index, which compares countries across the 10 policy areas of the Nourishing framework. The index findings were produced in two stages. First, we produced benchmarking scores, which include a value of 50 if a policy is present, or plus an average of design attributes. We then produced policy index scores, calculated as the average of benchmark scores. Finally, we categorized the results across 5 categories, as shown there, with a score of 100 indicating all aspirational standards are met, and 0 indicating that no policy was identified at national level. You can read more about both the development of the benchmarking tools and a pilot study on the validation of the Nourishing Policy Index in 2 papers published recently in Obesity Reviews. Next, please. So the comparative findings are presented and analyzed in our Nourishing Policy Brief, as shown there. You see there all the countries, the 30 countries that we have included in the brief. And next, please. We have also produced associated country snapshots for each of the countries, which present a more in-depth look at each country at benchmark level. You can see there the example for Italy, and you can scan the code to consult all. We'll hear more from Italy later on today. Please note that to produce these snapshots, we didn't only verify the policies that we sourced as part of our scan. We also shared the country snapshot findings with our in-country contacts who had verified policies. So as of today, we have received 25 out of 30 country snapshots received feedback from country contacts. These were based on feedback. They were updated after reassessing policies for inclusion and applying our benchmarking tools as well. I would say we're at the start of the process today. So we are asking countries to get in touch with us, especially if they're one of the few that have not done so yet. And we would also like to engage and make efforts on our side to engage with countries at national level, whether it be national policymakers, researchers, or indeed civil society groups. So let us go through the main findings. Next slide, please. Across the 30 countries, national governments have taken most action and implemented best designed policies in 4 policy areas of the Nourishing Framework. First, it's nutrition labeling. So this includes nutrition labeling regulations by the European Commission, as well as any front of pack labeling countries have implemented. So because we are looking at European regulations as well, most of these assessments will be quite uniform in this policy area. The difference between these countries that get the countries that get fair or a moderate assessment comes from whether they implemented, for example, front of pack labeling regulations, and as well as other nutrition labeling in settings such as restaurants, for example. Second, standards for food we look at policy area that includes standards for food served in schools, public institutions, and other settings. And we'll look into more detail on this policy area on the next slide. Third, we have reformulation policies, which also includes European regulations such as trans fat ban, and as well as agreements at national level between governments and industry, for example. Note here that about the effect of these regulations, such as the European regulations, as well as regulations that countries themselves have taken, such as limiting the content of salt in products such as bread, for example, and the interaction between such regulation and a policy such as voluntary agreement with industry. So what we found is that mostly food categories and nutrients were not covered uniformly by current regulations. However, the multitude of policy actions led to countries receiving a lot of good assessment. So likely this is an overestimate. And so we would like to draw attention that governments should consider whether attention to these kind of policies is better placed in other policy areas that get lower assessment, as well as assessing whether a wider range or appropriate range of nutrients or food products are covered by existing regulations. Fourth, we have public awareness about healthy food and nutrition. This includes food-based dietary guidelines, as well as communication campaigns on healthy eating. So, which we know is also a preferred policy area or preferred type of action by national governments, perhaps to the detriment of more population or structural policies. Next, please. So looking closely at policy area O, which includes standards for food and drinks available in schools and is particularly focused on young people, we see there the country snapshot for Latvia as an example. Latvia received a good assessment in this policy area. This is due to meeting aspirational standards such as mandatory regulations that assess both apply to both primary and secondary schools, among others, but also taking actions across most of the recommended benchmarks within this area. But we also see a lack of actions on restrictions on the availability of unhealthy foods in the vicinity of schools, which is a finding that applies to most of the other countries included in the index, as well as a lack of action on limiting sugar-sweetened beverage provision in schools. This applies to the other countries in the index. So moving on, the index found that countries in Europe have implemented policies that are in need for most improved policy design in 3 policy areas. First, advertising and marketing unhealthy foods to young people. That includes online advertising, but also different types of marketing, which we will discuss a bit in more detail on the next slide. We also highlight here a policy area with regards to nutrition advice and counseling in healthcare, including primary care, as well as healthcare school healthcare settings, as well as giving nutrition education and skills in schools, where a bit more than half the countries received a fair assessment. The Netherlands and Latvia here also get a good assessment for implementing policies in this area, not only on offering nutrition education, and they do so by not only offering nutrition education on curricula, but also training for educators and caterers, for example. Next, please. Looking more in depth at policy area R on marketing and advertising restrictions, we see that Norway gets the only moderate assessment out of the 30 countries, so the highest assessment, but still not meeting aspirational standards. Norway implements policies across 5 out of the 7 benchmarks or type of policy actions within this area, including online and broadcast advertising, direct marketing, product placement, and marketing in and around schools. However, existing policies should target children older than 13 to cover adolescents, which is a weakness of current policies implemented. Further gaps were also identified with regards to marketing to young people at point of sale and product packaging. Moving on, countries have taken least action in the remaining 3 policy areas, where we see a mixed picture with regards to policy design. First, we have policy area U on use of economic tools to ensure food affordability and purchase incentives. This policy area includes health-related food taxes, such as, for example, sugary drink taxes, but also income-related and targeted subsidies to ensure healthy food accessibility. The difference between countries that received a moderate assessment, for example, and a fair or poor assessment comes mainly from the design and implementation of a health-related food tax. So here we have 18 out of the 30 countries have done so. And also having implemented subsidies or universal programs on free meals in schools. Without these free school meal programs and well-designed ones, most countries would receive a fair or poor assessment. So therefore, this policy area is highlighted here as one of where the countries have taken least action. We also have a policy area H, which looks at harnessing food supply actions to ensure coherence between food systems and health. We'll speak further on this on the next slide. And finally, policy area S on incentives and rules to create a healthy retail environment. This includes policies such as planning restrictions on retailers, for instance. And we found least action by national governments in these policy areas across the 30 countries. And these are all clear examples of structural policies. Moving on to the next slide. So alongside, here we look at policies using supply chain levers to ensure coherence between food systems and health. Looking at this policy area, we see we have quite a bit of recommended policy actions, but many gaps. Among the policies where national governments did take action, we see public procurement policies, so 13 out of 30 countries have taken action, and governance structures for multi-stakeholder engagement. We see 12 out of 30 countries having implemented such policies. And you have there the example of Spain. Right, this has been, moving on to the next slide. This has been a brief overview of the Nourishing Policy Index findings. To find out more about how countries can improve policy design across these policy areas and benchmarks, you can consult our policy brief. You can scan our QR code there, also for consulting the full aspirational standards. Next slide. Finally, it is important to contextualize findings and be clear about what they can and cannot say. First, as an advocacy tool for civil society, we need to highlight that each policy area needs to be understood in the context of the benchmark we use to assess it, as we have explained for policy area U, for example. Second, we need to ask specific questions on each country context. For example, are countries with comparatively lower levels of overweight and obesity, are they also seeing an environment that already enable healthier diets? If so, can this explain if they have taken less action across the nourishing policy framework or index? Conversely, in countries with higher levels of overweight and obesity and less and environments that are less conducive to healthy eating, would they take more policy action in response to this problem, including with better policy design? So anecdotally, we heard from Swedish government contacts, and this is anecdotal, that there are no national policies on limiting provision of sugary drinks in schools, but also that the practice is not widespread. Here, there's also a question of using these standards for future proofing. Will this area require vigilance in the future? In the case of Sweden, for example. Fourth, we also need to highlight that this index only looks at national level policies, thus we don't look at provincial, regional, or local policies. This will impact, in particularly countries with decentralized governance arrangements or federal countries. Third, we need to make clear that we cannot draw any causal conclusions between these findings and the effect on overweight and obesity rates. However, the set of tools that we have produced will contribute to the research infrastructure and also can be used to generate hypotheses to be tested further on. Finally, we are aware that there are other tools that look at benchmarking nutrition policies at national level, such as the Food EPI. However, there are important differences in strengths of the nourishing index, such as using aspirational standards, not best practice criteria, being a tool aimed at civil society. So while we have made efforts to engage with governments, these tools are aimed at civil society, including you, to support efforts in asking for accountability from national governments. Finally, to the best of our knowledge, there is no gold standard on benchmarking nutrition policies. Therefore, there is an opportunity for cross-validation, which we have started with our pilot paper. Next, please. I have reached the end of my intervention and I will leave you with this. Today's launch is just the beginning. We welcome more opportunities to engage with national stakeholders, including civil society and policymakers. And this is what we'll be focusing on in the next 6 months. Thank you.
Thank you very much, Joanna. This was an excellent presentation, and you're right, this is just the beginning. And now we will have the panel present. And as you see, we will have Dr. Kremlin Vikramasinghe, who has a pre-recorded presentation, and he will then be joined by Dr. Miriam Heinen from WHO Euro on his behalf. Dr. Kremlin Vikramasinghe is acting head of the WHO European Office for Prevention and Control of Non-Communicable Diseases, the NCD office, and regional advisor for nutrition, physical activity, and obesity. Dr. Miriam Heinen is a trained dietitian and a nutritional epidemiologist who has worked for almost a decade on the topics of obesity, including being one of the lead investigators of the Childhood Obesity Surveillance Initiative, the COSI, in Ireland. Since 2021, she has been working as a consultant for the WHO European Office for Prevention and Control of NCDs, with the main focus on obesity. We will also be joined by Dr. Laura Rossi. She is the General Coordinator of Italian Dietary Guidelines Revision Committee at the CREA Research Center on Food and Nutrition in Italy. Laura has a large range of nutrition activity experience, such as public health activities in Italy and in international context. And the third panelist today is Susanna Bierzyńska, the only Polish representative in 2 international health-related programs, namely the Co-Create Youth Declaration Task Force and the Young Leaders in Diabetes project. She is a medical student, a type 1 diabetic, and an active member of the diabetic online community. But first, we will have the pre-recorded presentation from Dr. Kremlin Vikramasinghe.
Hello, thank you for the invitation to WHO Regional Office for Europe for this launch webinar. We are delighted to join from the WHO to share some remarks about the Nourishing Policy Index and how it could be used to advance the nutrition agenda in our region. WHO European region consists of 53 member states, all the EU countries, Southern European countries, and Eastern European countries. And we see many nutrition challenges in our region, whether it's come to breastfeeding rates or obesity prevalence, etc., or sort. If you look at overweight and obesity, 1 in 3 primary school children live with overweight and obesity in our region. This is shown by the WHO supported survey, Childhood Obesity Surveillance Initiative. But what's important is what can we do to address them? We have not seen a single country in our region who's able to meet the target to halt the rise of obesity. So what we can do is together look at all the nutrition policies that has been implemented, and we can see that different policies which are recommended by WHO as best buys or most cost-effective intervention have been implemented in different countries. But in order to tackle obesity and really promote nutrition, we need the comprehensive package of policies implemented in one place. But we don't have a place where all these policies are implemented. Now, to show to our political leaders that, look, each of these policies have been successfully implemented in countries, and to get their support to implement them would be the main use of this policy index. Why? Because despite the evidence, we often hear reluctance, lack of political will to implement some of evidence-based interventions or policies. This could be partly due to lobbying by vested interest groups, commercial determinants, and due to the data presented by some groups about the impact of economy or employment without very good evidence. In that case, one of the best interventions we can do to support those policymakers is to show best examples from other countries who have implemented them, how successful that implementation was, and these best practices. Therefore, having an index of collecting policies from large number of countries and making them available publicly helps all of us involved in promoting the nutrition agenda. One of the most important aspects of this is that having a methodical approach to verify this information and also providing examples. Therefore, many of these monitoring systems, not just the prevalence of nutrition indicators, but policy monitoring, needs to work in hand, and they could be complementary to advance our agenda. And then our member states can be beneficial. So for us, beyond the launch of this event, we want to work with stakeholders to implement them, to learn from other countries, and make sure a comprehensive package of policies are implemented. We have worked with many stakeholders in EU-funded projects such as Co-Create to learn how different voices, different stakeholders can be part of that process, how patients living with overweight and obesity could be part of that process, or young people, and then use their strength and voice to implement these policies. This is a long journey, but we hope regular improvements, reviews, and update to policy index is very useful. And as WHO and other civil society partners, together with the ministries of health, we can make the best use of it to create a positive impact in our region. We hope we can work with this tool, this framework, in order to advance this agenda. And as WHO, we are committed to do that. Thank you.
We certainly appreciate that invitation from WHO to work together, and appreciate how they see that this tool can supplement the work that they already have ongoing. So then we're looking forward to hear from Italy how the index has been developed and the relevance that you see that it can have. So welcome, Laura Rossi.
Thank you very much for the presentation and for the invitation. When I started to think to this presentation, my idea was to share in which way we Italy contributed in the work that was, in the fantastic work that was done for the creation of the country snapshot. Actually, please, the next slide. Actually, when looking in the website, for example, this is the WHO that summarized the policy. It is something that need to be updated, that need to be seen from other perspective than presented here. Please, the next part. I found this in the Global Nutrition Report that is a little bit more, again, that is a little bit more comprehensive. The other animation, please. That is a little bit more comprehensive, in which there is the combination of the national nutritional policies with the national policy targets. That is something that at the national level we do not evaluate. Next slide, please. In terms of the literature, I found very interesting this work that was recently published in the Lancet, in which it is possible to see the level of the level of application of the level of implementation of the different policies that are seen on the point of view of the Healthy Food Environment Policy Index. The next slide, please. This assessment in several European countries show the position of Italy, that is in this medium, with outcomes that are not very far from the outcome of the country snapshot that was produced in the framework of this project. Next slide. In terms of what I'm in particularly working, I'm particularly working in the areas as it was mentioned in the development of dietary guidelines. Please go on. In which please go on. In which we stressed a lot the issue of sustainable food consumption. Again. As an outcome of this effort in the publication of the new the last edition of the dietary guidelines, we make an effort also of publications in the international journal of the novelties, the main recommendations, and the policy implications. In this sense, we published also the most important novelties in terms of, for example, recommendation for dietary plans for infant, children, and adolescents. And please go on. And in particular, we published the way in which we considered the sustainability. We align the recommendation, the nutritional recommendation, with sustainability actions. All these things, I think, that should be particularly important in terms of policy. Another area of activity, next slide, please. Another area of activity in which I'm working on, please go on, is related to food losses and waste. We try to include the term of the actions, the policies, the recommendation of food losses and waste, please go on, in in the nutritional recommendations. We established an observatory that is an observatory on food losses and waste is a little bit reductive, because it is something a little bit more articulated, considering not only waste but also surplus and recovery, that in Italy are a very relevant component of the way to reduce food losses and waste. Please go on. In the framework of this observatory, we collect, we prepared several, we have several products, a report mainly in Italian. We have a website and also several scientific publications with the duly dedicated elaboration of the data that we collect also in this case is to establish a surveillance system and to develop policy to reduce food waste, in particular household food waste. Please go on. In this framework, I'm also the general coordinator of this project, that is the Planet project, that is a project founded by the European Commission, is an Horizon Europe project, just started, that include 24 partners across Europe, and cover 11 European countries. Details could be found in our website, but please go on. But in synthesis, the project has this ambition to provide recommendations for to address the nutritional policies nutritional sustainable policies at European level. Please go on. Going back on the key point of this my intervention here, why the work that was done by the Co-Create project and why the nutritional policy index is relevant for Italy. Two aspects. It is important for the government because the process helps the government in assessing their policy, in identifying the priority. It is important to align the national country policies with the international agreed target that for Italy is not completely fulfilled. It's a way to promote the coherence across the different policy areas and governance level. For us is very important, I mean, for us that we try to produce policies and to convince the policymakers to apply the policies, because it is something, it is an evidence document in which we could analyze the gaps and the coherences. It demonstrates the need to put in place monitoring progresses, for example. It is an effort to limit the expert advice, for example, to provide evidence-based recommendation. That is something that is in Italy is still missing. The exercise is represent the possibility of having a kind of external glance to the national nutritional policies that could help in improving the policies, and the comparative analysis, the possibility to compare the other countries in order to improve our performance in terms of policies. Thank you very much for your attention.
Thank you. Thank you for this nice summary of how you see this being relevant for Italy. And I think in particular, if we are able to contribute to promote coherence across policy areas and governance levels, as you suggest, that will be a very significant contribution. So then welcome to you, Susanna Brzezinska. Looking forward to your intervention.
Hello everyone. As mentioned previously, I am a youth advocate into international projects related to health, but today I'm going to focus only on one of them, the Co-Create Youth Declaration Task Force project. So without any further ado, let's just jump into the topic. Next slide, please. The task force's members' journey began in 2020 when we first met online. We were working together for about 4, maybe 5 months, firstly trying to brainstorm our ideas and look for relevant sources on the internet, and then secondly, writing the document itself. Next, we adopted the declaration in November 2020, also online. And what I think is important, our statement represents the voices of young people in general, is aimed at politicians and other stakeholders, and contains 4 main points, 4 demands. Next slide, please. The demands are written in the slide, but I will quickly read them to you out loud now. Stop all marketing of unhealthy foods to children under the age of 18 years. Secure all children high quality, practical-based food and nutrition education in school and a healthy school cafeteria. Implement a sugar-sweetened beverage tax to make unhealthy foods more expensive. And offer all children and adolescents free organized physical activities at least once every week. Next slide, please. But well, writing a statement is not enough. We are perfectly aware of that. And that's why since November 2020, we have been promoting the declaration primarily online, but subsequently on site too during various conferences, symposia, workshops, dialogue forums, etc. Next slide, please. Okay, all right. Going back to the topic of today's session, let's talk about the Nourishing Policy Index, and let's look at the findings of the World Cancer Research Fund team. Or to be more specific, at 3 policy areas identified by them and put in the report you have all already seen today. The policy areas are called O, R, and G, and these letters stand for offer healthy food and set standards in public institutions and other specific settings, restrict food advertising and other forms of commercial promotion, and give nutrition education and skills. Interestingly enough, 3 of the policy areas pointed out by the group kind of coincide with what we, young co-creators, demand from our policymakers and other stakeholders. Because going back for a second, just to remind you, 2 of our main statements concern restricting marketing of unhealthy foods to children under the age of 18 years and securing all children high quality, practical-based food and nutrition education in school. The conclusion is that the actions in these fields are crucial because, as the report itself says, out of 30 countries, many of them, in case of the O and G policy areas, even the vast majority of them, don't have any policy or the existing policy dealing with a certain problem is poor or fat at the most. Therefore, what we have to concentrate on in the foreseeable future is trying to draw policymakers' attention to the lack of needed actions in the described fields, while at the same time sharing with them ideas about how to change the situation. The report actually does exactly that. Next slide, please. A conclusion here might not be the best word, but what I additionally wanted to say is that not only politicians can benefit from the research done by the WCRF group. We, members of the Co-Create Youth Task Force, have recently started working on the second version of our declaration, and we really want to improve it. And what I believe is that the findings of the Nourishing in the Nourishing report will help us make our own document even clearer and even more detailed. That's it. Thank you very much.
Thank you so much, Susanna, and we're really looking forward to the second edition of your youth declaration, and hoping and thinking that you really will benefit from the index, as you said yourself. So then we open up for questions and comments. Please use the question and answer button in the on the screen. as we wait for questions, I'd like to ask you, Joanna, if you could say a bit more about who you foresee are the end users of the indexes.
Yes, thank you. Thank you for the question. So as I mentioned in my presentation, the tools were developed with the goal of supporting young people, in particular as part of civil society in their efforts to engage in policy advocacy. But we also aim that these tools and tried our best that these tools be useful for policymakers as well as researchers in engaging with kind of improving policy design. So I spoke a little bit about the youth angle. Susanna spoke about the youth, kind of the usefulness for the youth declaration, which I was very pleased to hear. We also know that policymakers can utilize this policy design criteria and to improve current policies, in particular, perhaps with a more focus on structural policy, identify any gaps at national level, also identify opportunities for action at the interaction rather between national policy as well as local or regional policy. Researchers, we are now have created a baseline on policy design. So there is an opportunity there to compare higher scoring or lower scoring countries to identify how current policies can be improved. They can also identify where results could be supplemented by additional analysis at local level and in specific settings, exploring links with, there's a lot of questions, exploring links with overweight and obesity prevalence. And there is an opportunity to potentially do a repeat of these these country snapshots, for instance, which we will be exploring. We'll see if we will do it or someone else might need to take that huge task on.
Yeah, great, thank you. And Miriam from WHO, Kremlin touched upon it, but if you could say a bit more why you think from your end that this kind of policy monitoring is an important activity.
Thank you, Professor Klepp, for inviting us here, and it's great work, and congratulations with the launch of this today. Thank you for the question. Indeed, well, basically policies are our bread and butter. We work with all countries in our member states to help implement these policies and to address in this case like obesity, but also addressing in that sense the non-communicable diseases. And this, as Dr. Wickramasinghe already highlighted, this is really giving us a benchmark of the situation in these 30 countries. And this will also give like examples for other countries, because a lot of them are hesitant, like, you know, yes, evidence-based, but like we don't really want to implement them for all kinds of reasons. So this is really giving us like an overview of like, this is already implemented in the other countries, it's working. So yeah, we can really try to help with that. And as well, working with other stakeholders using this as well, because like what we realize, a lot of countries don't implement these policies. They don't like, especially like they implement a few, but not the full package. And now we also trying more to go for advocacy and really try to use youth, try to use patients living with obesity to really try to help, you know, and civil society really go from that angle as well, to put some pressure on the government and saying like, it's implemented elsewhere, why can't we do it here? Thank you.
Right, well, thank you. And back to you, Laura, if you briefly could share with us if you have some ideas of how we can make sure that the policy makers use these findings, that they find them and use them. Do you have any advice to us? Your microphone is off.
This is a good question. My idea, but it's my idea to use it, is to disseminate among the stakeholders, in particular to the ministries, for example, in the light of a new revision of the dietary guidelines, this could help in explaining some position that could be seen as too much strong by, for example, the ministries or by the lobbies. I don't know if we would be able to convince the lobbies with this, but at least inform them. This is what I was planning to do with this. I don't know what, I don't know how to suggest you to do, frankly.
And I think that's a good start, a good way to use it. We're running short on time, but maybe, Susanna, back to you for a final question. You did point to some ways youth can use these as an advocacy tool. Do you have any other good ideas or suggestions for young people, both in your own country and other European countries, how they might pick up and use these indexes as an advocacy tool?
To be honest, I don't have any specific ideas in mind at the moment, but I could think about it and maybe with my local youth groups, some ideas later on.
That would be great, and maybe even when you develop the next version of the of your declaration, you could add some ideas for local use as well.
And with other youth alliances in the 4 states.
Exactly. Well, thank you all for attending this launch. We have come to the end of it. We will share it electronically now following the session. And I also just want to remind you of the launch of the Moving Index, the webinar that we have at the same time tomorrow. So please join us for that. And then I just want to say congratulations again and thank you to the team at the World Cancer Research Fund International for the great job they've been doing developing this tool. Thank you very much. And goodbye.